Okay, I'm going to try to go through my SI joint problem, sacroiliac joint pain protocol. I'm going to try to explain what I'm doing as well as I possibly can, and we'll see how it goes. SI joint problems mostly are caused by dysfunction in the way the hip, pelvis and hip move in relationship to the spine, in relationship to the sacrum. Basically, to fix sacroiliac joint issues, what you're going to want to do is rebalance the hip. There's muscles that are tight that are holding you in the wrong place, and you're going to need to self-adjust these muscles by doing the stretching and movement protocol. Going to massage therapists and chiropractors like myself and having them push on you and try to realign your body is not ever going to work in the long run. You've got to put in the work and do these activities on your own time, by yourself. If you don't put in the effort and you don't put in the work, you can't really expect any kind of long-term results. So the first thing we're going to do for SI joint problems, we need to make sure that the front of the hip is nice and loose, because when you're moving throughout the day and walking, you want a good extension in your hip joint back. You don't want this to be locked up, because if this is locked up here, when you walk and you step forward, and it's locked here, it won't move, a lot of force, a lot of torsion and twisting is going to be translated into the SI joint in the back. So with SI joint issues, I always look to first the front of the hip, which is a little bit counterintuitive, but that's how a lot of these things go. So the first thing we're going to do is a hip flexor stretch. A couple of key points to this is that you want the two bones, these two bones here, the ASIS bones on each side of your pelvis, to be facing forward. For me, I need to really, I'm pretty tight here, I need to take my hips, my pelvis, and actually move it to where I want it to go. I want to move it to a nice neutral position. I don't want it twisted. I don't want it too far back like this. I want my glutes engaged here, squeezing the glute, pulling the pelvis in, continuously squeezing the glute, contracting these muscles to put the pelvis in a nice neutral position, and you should feel a stretch through this area here. And you want to hold this, and you want to continuously make sure with your hands that your pelvis is in a good neutral position. This is going to take a lot of stress off the SI joint in the back. Okay, so we're going to hold this, ideally 30 seconds, and just keep holding it, keep pulling the pelvis into a good position here, squeezing the glutes the whole time. Don't ever let go of that contraction in the glute. Then we can add to this, once you feel like we're getting a good stretch, you're going to raise the arm on the same side, up straight in the air. I know you can't see it, but reaching up towards the sky and bending towards the opposite way of this leg, trying to get a real stretch through this whole area here. Continuously squeezing the glute, never stop, just like that. You're going to do both sides. Again, setting up, find the two bones, point them forward. Use your hands to pull any kind of imbalance. You're going to try to level off your pelvis here. You want this and this side level. Two bones facing forward. Pull it. Squeeze your glute. Boom. Feel the stretch through here. Okay? And repeat what we just did on that other side. The next thing we're going to do is really try to loosen up the entire hip girdle. I like to do it this way. I basically get into a frog position here, and what I do is, I'll show from the side. Frog position, lift up, knees spread out, contract the glutes again. Contract until you feel a stretch in the inner thighs, and then what I like to do here, up, is move side to side. And you'll want to experiment with this on your own and just tweak the angles. You just want stretch here, and you just want movement. You could go one side, the other side. You can come up again, squeeze the glutes, bones facing forward, nice and level. Okay, you're going to do this. There's no set amount of time, just do it. Maybe three or 4 minutes side to side, rotate around, okay, like that. Now, once you feel like the hips are nice and loose, you're going to go into a squats. This is the hardest thing to teach. I'll try to do as well a job as I can, but for a squat, you want it to look like this, like that. Most people, when they're starting a squat, what they do is they'll start by bending their knees, and this is wrong. So this is what I don't want to do. Down like this. See how the knees came over my toes? You don't want that. You want to start by pushing your hips back, like you're going to sit on a chair. The weight is mostly on my heels. Push the hips back, weight on the heels, knees are behind the toes, continuously go down, chest is up, like that. You're going to do 10 of these. 3, 4. Don't start with the knees. Hinge back, 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 chest up, and then drive up from the heels. The more you practice that, the better you'll get. You might want to reference other videos on YouTube about squat technique and form. But for me, I found these 3 things, the 2 stretches and the squats, combined with the Egoscue supine groin stretch that you can YouTube, so Egoscue supine groin, those 4 things will get rid of your SI joint problem permanently, in most cases I've found.